Good evening, everyone. I want to welcome everyone to our virtual Think Red ILM kickoff. Today, we will be going over HIV 101 and COVID-19 information. I would like to inform everyone that the webinar is being recorded and shared on our website as well as social media platforms. So if there are any objections, please speak up, excuse oneself, and you may view the event after the recording is shared. I will start by introducing myself, give some background on Seeds of Healing, and then my fellow Seeds of Healing team can introduce themselves. So my name is Destiny. I've been volunteering with Seeds of Healing since December 2019. I'm super passionate about the work that this organization is doing to educate individuals and destigmatize HIV. So Seeds of Healing is a nonprofit firmly rooted in Wilmington, North Carolina community. An advocacy and action organization, Seeds of Healing seeks to deconstruct myths that perpetuate fear and stigma and generate sustained support for women with a diagnosis of HIV. Since established, Seeds of Healing has implemented the Seeds of Healing Retreat, which engages women living with HIV. The attendees range in ages from 35 to 60 years old, and these women have been living with HIV for more than 10 years. Seeds of Healing has an established reputation among the local community as well as the extended county. So now if my fellow teammates would like to introduce themselves.
Hi, I'm LaShonda Wallace. I am the founder and executive director for Seeds of Healing. I want to thank you all for being here, and you'll learn more about Seeds of Healing if you continue to participate in our programs, especially those that are going on virtually during this COVID-19. And for those of you who are impacted by HIV in one way or another, or you have some events going on and we can collaborate, feel welcome to keep in contact and reach out. And I'm going to pass the mic to Jeff Mills.
Hello, how are you all doing? It's nice to see you. Thank you for joining us. Today, we just want to let you know that, well, first of all, I'll introduce myself. My name is Jeff Mills. I live in Wilmington, North Carolina. I am an advocate for long-term survivors of HIV/AIDS. I have been in an organization called SAGE Wilmington for a number of years, which is supported by the Frank Harr Foundation here in Wilmington, North Carolina. Today, I hope that we get the chance to discuss kind of the nature of what COVID-19 is like in terms of what it's been like to be an HIV survivor. You know, it's kind of like deja vu all over again. And all of us are now in a community that's at risk. And those of us that have been in an at-risk community for a long time have a lot to share about it. Oh yeah, and I'm 72 years old. Thank you.
I see Dr. Hunter Jones is next. And you can pass the mic when you're done, Jocelyn.
I think you're muted.
Oh, are you guys waiting on me?
So I'm Jocelyn.
I'm sorry, I'm having connection issues right now.
I'm Jocelyn Hunter Jones. I've served as an HIV advocate and educator for many years, and I serve on the board of directors for Seeds of Healing. Really excited about this kickoff event, and I'm going to pass the mic to Jeffrey.
Well, okay. Can you hear me?
We
Can you
can.
hear me? Oh, okay. Like I said, I'm sorry. I'm having connection issues here. I'm Jeffrey Long. I'm here on the eastern band of Cherokee Indians Reservation. I've been working with HIV advocacy for about 5 or 6 years now. Do a lot of lobbying with NCAN out of Charlotte, WinCap out of Asheville. So I pretty much spread myself around through the Western North Carolina part of the state. What else was I supposed to speak of?
LaShonda's muted too.
Pass the mic to Albert.
Hello?
We hear you, Albert.
Oh, okay. So just a brief introduction from me then.
Yes.
So my name is Albert Trego. I volunteered with Seeds of Healing and alongside Dr. Wallace and Dr. Mackie King over at the NHRMC HIV care team in the spring semester of 2019 for my internship with public health at UNCW. I'm honored and privileged to be invited to this virtual virtual event. Is very special, and I'm glad to just kind of help out where I can. I'm going to be volunteering in the capacity of facilitating tomorrow's virtual event. So, not a whole lot else about me. Glad to be here, though.
Thank you. I think another board member, Mindy Yates, is with us.
Hey everybody, I would show myself, but I apologize. I've been painting a fence all day and have paint all over my face. Anyways, my name is Mindy Yates. I am a member of the board of directors for Seeds of Healing. I went to nursing school about 12 years ago, specifically to work with the HIV population. I was blessed to work in the HIV care team clinic at New Hanover Regional Medical Center for 8 years. I stopped working a full-time job about 2 years ago to take care of my little ones, but this is a way to keep my foot in the door and kind of keep my passion alive. So I am happy and blessed to be here. Thank you.
Hey y'all, my name's Juliana. I am currently Seeds of Healing's intern for this year, and I was very excited and honored as Dr. Wallace took me under her wing, and I'm excited to see where this event is going.
Thank you. Do we have any other Seeds of Healing volunteers or board members that are on the line? Thank you, everyone, for your introductions.
So now we would like to take the time to thank our sponsors, supporters, and donors. And as I call out our sponsors, supporters, and donors, if anyone would like to self-introduce and make a few remarks, please do so. Thank you to our gold sponsor, Gilead. Is anyone on from Gilead? So Gilead Sciences is a biopharmaceutical company that discovers, develops, and commercializes innovative therapeutics in areas of unmet medical need. The company's mission is to advance the care of patients suffering from life-threatening diseases worldwide. Our sponsors are Wilmington Health and Tri-Coast Installation. So Tri-Coast Installation is a highly experienced supplier of cost-effective installation services to clients in North Carolina, South Carolina, and Virginia. And then Wilmington Health, since 1971, they've been committed to the care and health of our community in Wilmington, as well as all of southeastern North Carolina. Wilmington Health is a physician-owned primary care and multi-specialty medical practice. So in this way, they are able to provide a comprehensive and coordinated approach to the care of all of their patients. Our 2020 supporters are Trevor Yates of Edward Jones. He is a financial advisor who believes it's important to invest his time to understand what you're working toward before you invest your money. It's also important to understand the level of risk you're comfortable accepting when investing, so they can balance it with the steps necessary to reach long-term goals. And then Viv Healthcare was established to take a fresh approach to the challenge of HIV. They set themselves with one mission: to leave no person living with HIV behind. Our 2020 donors are Costco, Islands Fresh Mexican Grill, and our 2020 vendors are the North Carolina AIDS Action Network, Catherine Kirby of Planned Parenthood of Wilmington, North Carolina, and Thaddeus Karen, an insurance broker. Thank you much for your support. A few event logistics. So all of our events will be accessible through Zoom. The code for the event will be sent to your email if you're registered, or you can access it via the Seeds of Healing website on the virtual HIV/AIDS Run/Walk 2020 dropdown events tab. Our calendar events. So tomorrow at 7 p.m. we have a prep talk with Dr. Mackie King. And then next Tuesday, July 28th at 6:30 p.m., we have an HIV advocacy panel with Cressy Stokes, Jeffrey Long, and Jeff Mills. And then August 1st through 3rd is our virtual 5K run or 1 mile walk. Registration for the event is accessible through Facebook, Seeds of Healing Inc. website, as well as Eventbrite directly. It's $25 and it includes real-time access to webinars and presenters, an event t-shirt, an event race bag, and eligibility to win prizes. There will be raffles at the end of each webinar for all the attendees, and then one race winner with the quickest time for both the run and walk, as well as one race winner for both the run and walk for registrants who have attended all of the webinars. The prizes were kindly donated by Trevor Yates of Edward Jones. So since we're doing this virtually, participants must download the Map My Walk app from the Google Play Store or the Apple Store. You add Seeds of Healing Inc. Think Red ILM as your friend, and then log your run or walk anytime between August 1st and 3rd, and share it on our Facebook event page. So you must be our friend with us on the app for us to be able to have access to your confirmed time. So now I'm going to hand it over to Juliana.
All right. So this poll is a quick survey of how or of what you know about HIV already. This is anonymous. We can't see who's answering these questions, but what these questions are for our statistics and how these events or how the slide is going to change the way you see HIV before and after the learning event. So if you can, take a moment to submit this poll to us. If everyone is done with the poll, we can go on to the next slide.
I want to thank everyone who was able to participate in the poll. A lot of people that are on this call is very informed. However, we are also sharing to the general public via social media. And for those of you who knew the answers, I'm pretty sure that there was someone out there who needed the information and really appreciate it. We do have a couple of other attendees. I do want to take the opportunity to recognize these attendees because either they support Seeds of Healing or they're doing great work in the community and in the state. And if they were not mentioned in the previous introductions, if they want to share, I just want to have the opportunity to make everyone aware of their presence. So we have Lee Sorrow from North Carolina AIDS Action Network. Lee, do you want to unmute yourself? And yes, thank you.
Yeah, hey, I wasn't expecting to say anything. Always just love tuning into y'all's events, but can you hear me okay, LaShonda?
We can. Thank you for being here.
No, it's I'll just say hi really fast. We've got a lot of great advocates down in Wilmington and always love working with the New Hanover crew. And I'm Matt Martin and Rita McDaniel and I from NCAIDS Action Network have often attended this event in person down by the lake in Wilmington. And no, it was really disappointing to have to cancel this year. But I think it's really exciting how HIV advocates are coming together virtually. So we'll keep being part of that and happy to tune in and be with y'all tonight.
Thank you for being here. We do have, as Destiny mentioned, we do have the Planned Parenthood of Wilmington here. Ms. Kirby, would you like to do a welcome?
Yes, thank you so much. Can you hear me?
Yes, we can.
Okay, perfect. Yeah, so I am Kat Kirby or Catherine Kirby from Planned Parenthood here in Wilmington. I'm our local community organizer. Thank you so much for having me and for the work that you do. I just wanted to remind you all that we do offer PEP and PrEP, so pre-exposure prophylaxis and post-exposure prophylaxis, as well as HIV and other STI testing at our Wilmington Health Center. And recently we've added transgender healthcare. We also offer abortion services and a whole other gamut of services that are LGBT inclusive, and we're all trained in all kinds of things to make our experience the best that we can for our patients. So feel free to ask any questions. You can send me a private chat on here and I'd be happy to answer anything. But thank you again for having me. I appreciate it.
Thank you for being here. We also have Ms. Vonnie Goodson, who is the director for Bridges of Wilmington. Vonnie, would you like to give a welcome?
Thank you for the introduction, Dr. Wallace. I just am very grateful for you and Seeds of Healing for all of the positive work that you're doing in the community. Great job and thanks.
Thank you, Vonnie. All right, so we're going to get right down to it. So HIV 101, I know that we already did the poll, so we're going to make sure that we get all our facts right. Some of this information you've heard before, but we want to just make sure that there's anything that you may have a myth about, we want to clear it up and make sure that you have the facts. That's what we're here for. So what is HIV? HIV is a human immunodeficiency virus, and it actually is the virus that can lead to AIDS. AIDS is acquired immunodeficiency syndrome, and that will occur if HIV goes untreated for a long time. So someone could be HIV positive, but that does not mean that they have AIDS. So we just want to make sure that everyone understand that. However, when the CD4 cells are used up by the HIV virus, the CD4 cells is what we have in our body that protect our immune system. When the virus replicates in those cells, we cannot defend ourselves from other infections, such as certain cancers, certain types of pneumonia. And that is when the occurrence of AIDS actually happens. You actually have a syndrome of occurrences that would typically not occur in a healthy individual. Medication for those who are living positive is considered antiretroviral therapy. And it is a combination, it's a cocktail. Many people may have heard the term cocktail before. It is a combination of HIV medication that is used to treat HIV, But again, we want to reiterate for those of you who may not know, HIV is not curable. However, it is treatable. So therapy reduces the viral load. When clients come to the provider, they have a number once they're diagnosed, and we follow that number until they become undetectable. The HIV virus stops replicating, it stops multiplying, and the CD4 cells, which protect your immune system, can now replicate, and it can make sure that your immune system is healthy so that you can fight off general infections that we do from day to day. HIV is transmitted through infected bodily fluids, which are blood, semen, pre-seminal fluids. I may have to put the dogs out. Pre-seminal fluids, vaginal fluids, rectal fluids, and breast milk. In the United States, the most usual occurrence of HIV transmission is through vaginal and anal sex without the use of a condom. Sharing drug injection items such as needles or works is also how HIV is transmitted. You cannot get HIV through holding hands, through hugging or kissing, through using or sharing utensils, toilet seats, air particles, mosquitoes. I think I saw 100% on that answer. You cannot get it through mosquitoes or any other blood-sucking insects. In North Carolina, there are disclosure laws. And what that means is a disclosure law is a release of information about a person or entity. In North Carolina, it states that a person living with HIV must disclose their status to future sex partners unless they have been virally suppressed for at least 6 months or they are a victim of sexual assault. And we share this information because there is a history of overcriminalization of people that are living positive. However, those who are living positive are engaged in care and have been undetectable and consistent in their care for 6 months or more and are undetectable. We encourage your discretion in your use of sharing information. However, you are protected by the disclosure law of North Carolina. Everyone should understand their HIV risk, right? So just over 40% of people living with HIV in the United States are people of color. And Seeds of Healing, although our resources and our services is for anyone that is affected or infected with HIV, we are very passionate about our intimate work to protect vulnerable populations. And so this data is really important. Again, I want to reiterate, 40% of people living with HIV in the United States are African American. However, we're not even a quarter of that population when it comes to the census. More than 40% of new HIV infections in the US occur among African Americans. So if we all had a test today and we were diverse, 40% of the new infections, they would be of African American. That is what the statistics are showing us. 1 in 20 African American men may be diagnosed with HIV in their lifetime, and 1 in 48 African American women may be diagnosed with HIV in their lifetime. The epidemic in the South is giving us a lot of information about the need to be well-informed, tested, and protected. Southern states account for an estimate of 51% of all new cases each year in the United States. African Americans are disproportionately affected in every risk group. It doesn't matter if you're a woman, it doesn't matter if you're a man, it doesn't matter if you are a man who has sex with men or someone who injects drugs. When it comes to the numbers, African Americans are disproportionately impacted. We account for 53% of new HIV diagnosis in the South. Black, gay, bisexual, and other men who have sex with men account for 6 out of every 10 new HIV diagnoses among African Americans in the South. And again, women in the South account for 67% of new HIV diagnoses among all women in the South. And when it comes to mortality rate, what we're referring to is death. In the South, the likelihood of death if you are diagnosed with HIV, especially a late diagnosis with advancement of disease, in some states in the South, there's up to 3 times higher than our northern counterparts that death could unfortunately occur. And what are the factors? So the factors are poverty and unemployment, all right? So what we do know about HIV, any of those social determinants when it comes to economics, lower income, poor, lower education achievement, living in rural areas, all of those things that affect people that are from disenfranchised and marginalized backgrounds, those are risk factors. Access is a barrier. So nearly half of all Americans without health insurance live in the South. So if you do not have health insurance and you are HIV positive, that is a barrier to care. That is also a risk for actually having HIV. Lack of transportation, longer time for travel to get to your appointments, that can be a burden. Reduced availability of medical and social services, fewer providers with an expert in treating HIV. It's not easy to treat HIV just to be a provider that can write a prescription, okay? There are special populations that have special needs, and understanding the needs of your clients and providing compassionate care is an art when it comes to being an HIV provider. And cultural factors such as stigma, which is very pervasive in the South, is often associated with stigma around sexual orientation, substance use disorders, poverty, and sex work. I also just want to add that there's a limited uptake of pre-exposure prophylaxis in the South, and fewer people with HIV in the South receive timely medical care for treatment. Stigma. One of our missions with HIV is to reduce stigma. We work really hard to make sure that people have the knowledge that they need to know, can understand it, and understand that HIV does not discriminate. So to treat people differently and poorly because of their HIV status, that is something that we work really hard to mitigate and to work against. There are several types of stigma. Stigma can be self-internalized, where you have a negative or self-judgment about yourself that result in shame or worthlessness and blame. Stigma can be institutional, governmental stigma, a country's discriminatory laws. North Carolina and California were 2 of the states in our nation who actually changed their disclosure laws so that people living positive would not be over-criminalized because of their HIV status. That's an example. Healthcare stigma, discriminatory attitudes held by health providers that could lead them to make judgments about the people that they care for. That is a barrier to care. And again, unemployment. Stigma in the workplace. People living with HIV may suffer stigma from their coworkers, their employers, such as social isolation, ridicule, or experience discriminatory practices such as termination or refusal of employment. Stigma around HIV include believing that only certain groups can contract HIV. HIV is not an infection for people who inject drugs. It is not an infection of only African Americans. It is not an infection for men who have sex with men. HIV does not discriminate. We can refer back to how HIV is transmitted, which we talked about at the beginning of this discussion. Making moral judgments about those who may have it or taking preventative steps is also a way, is also conversation around stigma. Feeling that someone deserved HIV because of their choices, and those who are positive may, as a result, receive poor treatment of health care, be shunned by their family members or peers, and experience judgment, insults, or harassment. All of these are examples of stigma. what we want to do is reduce stigma. We want to make sure that we use language that is supportive and does not have any negative connotations. For instance, if someone is HIV positive, again, they're in care, they're undetectable, they do not have AIDS. When people hear the term AIDS, which is an unfortunate circumstance, a lot of people think end of life, they think death, and it can be scary. However, when you hear HIV, it is not always associated with AIDS. So that is an example. Emphasize the rights of and protect the privacy of people that are living positive. Know that there is a difference between privacy and secrecy. Because someone is private about their HIV status, that does not mean that they're being secret. That does not mean that they are intentionally putting other people at risk. But everyone is, they have the right to their privacy. Reduce barriers to prevent treatment and services. So for instance, North Carolina AIDS Action Network, they work really hard to advocate at the state level about barriers for prevention, having Medicaid expansion, and that is an example of how you can get involved beyond the individual level. Education for health providers and community members. So I want to thank you all from the community who are here with this conversation today, and you're being educated. How do you prevent HIV? Abstinence. However, everyone does not necessarily practice abstinence. And if you do not, condom use, consistent condom use and correct condom use. So it's not just as easy to say, I have a condom, I'm not going to get HIV. You have to know how to use a condom properly. And that's why we have services such as health departments. There are community programs. You have Planned Parenthood, those who are away at education institutions such as colleges. Take advantage of those opportunities to go to programming that teach you and assure that you know how to use condoms safely and correctly. People with HIV can prevent transmission by having success with their medication management. Understand that you equals you. Undetectable is untransmittable. I want to reiterate that again. If there is no virus replicating in your system because you are on medication, HIV is undetectable in the system and it is untransmittable. And what I always use is an example of a mother who is carrying her unborn child. If a mother who is HIV positive and she is on treatment and she is undetectable and she can have a healthy and thriving baby that is HIV negative, there's no more closeness that you can get. How much more intimate could you get? Undetectable is untransmittable. After exposure, if someone is exposed to HIV, so for instance, an accidental needle stick in a healthcare setting, you can actually receive post-exposure prophylaxis if there was a sexual assault, or maybe the condom broke and you're not certain about what your risk may be. There is post-exposure prophylaxis, and we would encourage people to follow up with their primary care provider or emergency services in those instances. HIV positive women who are pregnant, mother-to-child transmission can be prevented through HIV medication for pregnant women, and we encourage women that are pregnant to receive prenatal care in the first trimester. For HIV positive women, we do not encourage breastfeeding in the United States, and the use of formula is an alternative. Harm reduction strategies to prevent transmission among people who inject drugs. Here in North Carolina, we have the North Carolina Harm Reduction. There are needle exchange programs where people that you need new needle works. We discourage sharing of needles, and if you need to swap out with a needle exchange, there is a North Carolina Harm Reduction program, and you can access their information through the websites or through social media. They're on social media for a location near you. I just want to let you know that a woman who is on medication consistently, in the US, we have 1% or less occurrence of babies that are born with HIV from a transmission from their mother. And in the event, in the absence of an intervention, meaning the absence of medication use, transmission rates are 15 to 45% from mother to child. But again, because women are receiving prenatal care in the first trimester, in the US, transmission rates from mother to baby is 1% or less. Local resources, here we have Planned Parenthood, we have Coastal Horizons, we have the New Hanover County Public Health, we have the Wilmington Health Access for Teens, and Partners in Caring. If you are viewing this event, all of their addresses are on the screen. We encourage everyone to have at least one HIV test in their lifetime, especially if they are between the ages of 13 and 64. And if you are at a higher risk, because of any of the instances that we talked about previously, we recommend that you get tested more often. If you answer yes to any of these questions, you need to have an HIV test. And these questions are you a man who has had sex with another man? Have you had sex anally or vaginally with a person who is HIV positive? Have you had more than one sex partner since your last HIV test? Have you injected drugs and shared needles, syringes, or other drug injection equipment, such as cookers, with anyone else? Have you been diagnosed with or sought treatment for another sexually transmitted disease? Have you been diagnosed with or treated for hepatitis or tuberculosis? And have you had sex with someone who could answer yes to any of the questions of above? Because remember, you sleep with your partner and your partner's partners. If you answer yes to the following questions and the last time you were tested for HIV was over a year, you should have a test as soon as possible. If you have any questions or comments, please put them in the drop box. We will definitely get to them. I don't see any questions. I do see the comments. Thank you, Jeff. So we're going to do this poll one more time to see if we can get 100% from everyone who's on the line. You can start taking the test. Everyone should have answered the questions by now, and we're going to end the polling and share our results. Thank you all.
Good teacher, LaShonda.
I do my best. Thank you for the encouragement. HIV and COVID-19. I'm going to keep it simple for you right now. And first, we're going to start off with some precautions and some general knowledge. And what we want to make sure that everyone knows, we want you to wear your cloth face covering, wait if you're in line, 6 feet apart, avoid close contact, wash your hands often, or use a hand sanitizer. When you're washing your hands, you want to do that for 20 seconds. If you are in an audience or a meeting, enclosed, we encourage no more than 10 people, 6 feet apart. And if you are in an open setting outdoors, we still do encourage 25 persons or less. Stay at home if you are sick, except to get medical care. Cover your mouth and nose. Cover your mouth and your nose with a cloth face covering when you're around others. Cover your coughs and sneezes with tissue. And again, avoid touching your eyes, nose, and mouth with unwashed hands. And I want to reiterate that because we use our hands to pull our mask down very often. We use our hands to remove our mask from our ears. But every time you do that, if you have come in contact with a doorknob, a table, or a dresser, and it's on your hands, you're putting yourself at risk. When that mask is on and it is over your mouth and your nose, leave it there. Leave it there. I want to encourage everyone to leave it there because there are instances where people say, I wore my mask, I washed my hands, I sanitized, and I don't understand my risk. Why did I get COVID-19? We just want to make sure that you are practicing all of the strict encouragement of restrictions, and we want you to remain vigilant. These are some facts about HIV and COVID-19. Since March, on March 20th, North Carolina, we only have 40 instances of documentations of COVID-19. As of July 20th, there was 1,268 cases. However, I'm encouraged because on July 18th, there was 2,481, and that was North Carolina's highest peak. So I hope that that trend continues to go down. Myths about HIV and COVID-19. I know that Jeff mentioned he's so excited about this conversation about HIV and COVID-19, and I just want to share with you guys some of the myths that I've heard. One, there is not a shortage of medication for people that use antiretroviral therapy. No one is giving it all away to people to treat COVID-19. There is access. Antiretroviral therapy will protect people living with HIV from COVID-19? No. Because you're on therapy, the medication you take does not protect you from COVID-19. The medication you take, it treats HIV. So if anyone told you that, that is a myth. Antiretroviral therapy will protect the general public from COVID-19. If a physician have not prescribed an antiretroviral therapy under their medical management, we discourage the sharing and the use of unprescribed medications for the treatment of COVID-19, especially in the general population. Those are myths. The fact is, COVID-19 is likely greater for HIV positive people who have a low CD4 count. In the beginning of this presentation, we talked about having a weakened immune system because the HIV virus uses up your fighters, your immune system, your CD4 cells. Where those CD4 cells are low, you do not have full viral suppression. You are nonetheless, you remain at a high risk for COVID-19, just like the person that is living with cancer, the person that is also at risk because of other coexisting conditions such as cancer, high blood pressure, a chronic respiratory disease such as COPD, diabetes that is untreated, cardiovascular disease, and obesity. The fact is, the fact is COVID-19 is also at an increased occurrence among young adults, and people who are being screened for COVID-19 have actually had an uptick in a contribution to HIV screening. Because when people present to their physician or the emergency department for a viral syndrome workup, screenings for HIV have actually increased. People living with HIV are returning to care, and that is referring to people that have been out of care. It may be provoked by fear of illness for COVID-19, and people are like, oh, I need to get in care. These may be people that have been feeling good, living positive, and not on treatment. Well, we do see an influx of people returning to care. Are people living with HIV adversely impacted by COVID-19? Well, as we mentioned before, people that are living with HIV, particularly in the South, if you're living in poverty, if you are in a rural area, all of those same social determinants, if you have lack of knowledge, yeah, you are adversely, they will be adversely impacted by COVID-19. Those are the facts. You guys have any questions? Juliana, do you want to share from the chat box now?
Yeah, so thank you for everyone who has been chatting with us and leaving us very nice comments. Thank you, Dr. Wallace, for your amazing presentation. What we have promised to do is a raffle between everyone, and I have set that up. So I'm just gonna go ahead and tap away now, and whoever it lands on wins. And it looks like that.
You want to share your screen so they make sure it's fair? Can you do that?
It's not on my computer because of the way it is, but I will be doing it on my cell phone.
Okay, we trust you.
I'm sorry if I misspelled anyone's name. Jeff, you are the winner.
Which Jeff?
Mills.
I want to thank my public.
So congratulations to Jeff.
Well, that's a thrill, and I'm not exactly sure what the prize is, but I'll be sure to share it.
Well, I do want to share with everyone that our prizes have been donated by Islands Mex Grill, as well as Trevor Yates of Edward Jones. So we will be in contact with our winners, and your prizes have a value of $25 for the webinars. If you really want to get in on the big bucks, you got to participate in all the webinars and the run and the walk.
Okay, we would like to just give another thank you to all of our sponsors, supporters, donors, registrants, and collaborative partners. Just to go over event logistics one more time so everyone is clear. Each of the online events will be accessible through Zoom. The code for the event will be sent to your email if you're registered, or you can access it via the Seeds of Healing website on the virtual HIV/AIDS Run/Walk 2020 dropdown events tab. Registration is accessible through Facebook, seedsofhealinginc.com, and Eventbrite directly. It's $25, and it includes real-time access to webinars and presenters, an event t-shirt, a race bag, and eligibility to win prizes. Since we are doing it virtually, you have to download the Map My Walk app. You can get it on the Google Play Store or the Apple App Store. You add Seeds of Healing Inc., Think Red ILM as your friend, and then anytime between August 1st or August 3rd, you log your run or walk and share it on our Facebook event page. And you must be a friend with us in the app for us to have access to your confirmed time. And that is it.
Thank you all for being here. I just want to let you know that these are our race shirts this year. Hopefully you can see me because I can't see myself. These are the shirts for the females. And these are the shirts for our males. And we're going to mail them out to everyone who is already registered. We're going to start sending things out beginning of next week. Thank you all again for your continued support.
Thank you. Thank you. Great to see you all.